Yeah, Lake County Budget Committee to order for Tuesday, May 12th. Christine, you had some, do you do the minutes first, or did you want to do your?
You can go ahead with minutes
Minutes,
first.
okay. We got the minutes handed out. Did we want to approve them today, or did chance, I mean, it's,
Online.
okay.
And I didn't take a blue pen to every little thing.
Does anybody have any corrections or changes that they want to bring up? Oh, that's me.
Well, yeah, that's a little,
A little delay in case you curse.
Oh, they can cut it
Recording
off.
is
Cool.
repeating to us in the room.
you'll
See
hear that
if you can
again.
hear us.
They will in about 3 minutes.
He's probably on their way.
Can you revise this first?
Okay, do I have a motion to approve the minutes?
Move that we approve the minutes. From, whatever the hell.
Okay, it's been moved and seconded to approve the May 5th minutes. Any discussion? All those in favor? All right. And now, Christine, you want to do the TLT, is that correct?
Yes, yeah, one of the many handouts that you just received was a packet of some TLT information. Just given the public comment that was received, I thought it would be helpful to provide a little bit more detail for you. So the first page is the what is in the proposed budget. Starts out with the ongoing revenue and the allocations that are happening there. You'll notice that there are 2 asterisks by the first 2 items. And that is because those are not specifically designated in code, which we're also giving you that language, but that is something that the Budget Committee does through motion. Those of you that have been on the committee might remember that. And then the 2% tax is shown separately because there's been conversation about that specifically, the split there. And so showing you the total TLT revenue that is in the proposed budget is the 15.8 million. Then the next section, starting with kind of the light orange, is reserves of the 2% tax. This isn't estimated, what we believe will be there on 6/30/2026. And so that amount, and then showing the split between non-tourism and tourism. There have been a couple items, projects out of the tourism part related to a covered bridge stabilization and a feasibility study for a multi-use facility. So that's the budget information. Then we did go ahead and print for you the lane code that specifically talks about where TLT is allocated unless otherwise directed through the annual budget process. It has that language in the code. And then we went ahead and provided House Bill 4148, which had some conversation as well, the changes, so this is how the statute reads after those changes. So just let us know if there's additional questions.
Sure. Commissioner Seneca?
So here at the 50% non-tourism fiscal year 26-27, the $611,000, 224, is that the one-time reserves from last time that's left over that's going to
Correct.
get expended this? Okay.
Yeah, that's
Gotcha.
the estimated leftover amount. We'll know for sure when the year ends, but that's what's budgeted, yes.
Copy. Perfect.
Any other questions? Okay. All right, then I guess we'll move right on. Steve, I think it's your turn.
Okay. Thank you, Chair Weber and members of the Budget Committee. I'm Steve Adams. I'm the Policy Director for County Government. I work within County Administration, and within my portfolio is responsibility for managing state and federal affairs for county government, as well as some of our major federal funding grant opportunities, and trying to monitor issues at the state and federal level. So my task is to update you on what we're seeing now, both in DC and in Salem. So let's see. Nope.
Do we need to elevate your leg, Greg? Do we need to elevate?
Yeah, I'm
Or not?
fine. It actually, I've gotten most of my motion back, but still swollen, still hurts.
No surgery though.
Not yet. I don't have an MRI until the 21st. So, I'll just be hobbling.
Maybe that's why they're building that new facility.
Yeah, I mentioned that to Slocum, and she goes, yeah, that's just for surgery, we don't get to move, this was the doctor's orders, and we don't get to move.
Jasper, thank you.
And because I have a rod in my leg, I need to have a special one. So,
Okay. Right. Thank you, Chair and Committee. So I think just in the context for this committee's deliberations, as you're contemplating and trying to look into your crystal ball about the state and federal implications for the budget year in which you are trying to set a budget. I think the context of where we are is that there is an election in November that is quite consequential. We're continuing in the kind of final months of the current session of Congress. The last 18 months in Washington have been fairly significant, specifically with both in terms of executive actions taken by the executive branch, executive orders, rule changes, rule repeals, new rules, a lot of regulatory activity, and then some fairly consequential legislative activity as well. I think certainly House Resolution 1, HR 1, or the One Big Beautiful Bill has been the kind of most sweeping legislation that the current session of Congress has been working with, and that has already impacted county government, the state of Oregon, and will continue to have some implications for us. Specifically, Congress is obviously in a majority, very narrow majorities in both houses. So it is really a challenging legislative environment for the Senate Majority Leader and for Speaker Johnson on the House side as well. We've got some policy issues of note that continue to be litigated. Things like tariffs and other kinds of policy changes that are being considered by the court that have some economic impact for us. And we continue to see at least some indications of what state government or the state legislature in particular will be doing with some of the changes that have yet to kind of wash down. So that's kind of the context. Basically, baseline is a lot of change, not entirely sure how the heck this is going to impact us, but we can try to kind of prognosticate a little bit. So currently, right now in Congress, the federal fiscal 26 budget year is done. Congress has appropriated all of the funds for federal fiscal 26 through the regular appropriations process. Now, there's an exception for immigration enforcement and for customs and Border Patrol, which have not been funded through the regular order appropriations process. They're now being considered through a separate process called the budget reconciliation process. It's a special kind of budget maneuver. It has to have a fiscal nexus for federal policy, and if you managed to navigate the requirements of this process, you can get this through without a filibuster on the Senate side. That's the chief benefit of the reconciliation process for the party who has a majority in both houses and has alignment with the White House. And so right now that is being considered. The House and the Senate have two different kind of views of what would be included within the reconciliation process. What they're contemplating is essentially funding ICE and Border and Customs through the end of the current administration. So it would be a 3-year funding package. It would essentially take additional appropriations off the table for Congress as they go through the regular order for funding the Department of Homeland Security and the rest of government. There is debate currently. There's a proposal to put some additional funds into the budget for the White House ballroom that Mr. Trump has proposed in both sessions. Both houses are debating that even as we speak. So putting that aside, the fiscal 27 Appropriations Act is underway. So this is the regular order congressional appropriations process to set allocations for agencies beginning on October 1 of this year and moving into the process. We got the president's recommended budget already this year. That begins the process, and we're moving that forward. What we saw for fiscal 26 and what we're seeing again so far is that the House is essentially starting with a lot of the White House's recommended numbers for a lot of agencies, which has been lower for the most part, with some exceptions. Certainly, Mr. Trump has recommended higher funding levels for the Pentagon. This year, there was a 50% increase for the Pentagon's budget, and he has consistently recommended additional funding for law enforcement and immigration control related matters. What we saw in 26 and what we're likely to see again in 27 is that the Senate numbers tend to be kind of closer to a historical mean across most of these agencies, and the final budgets that land will be in that process. We are seeing congressionally directed spending continue. This, of course, is the old colloquially known as earmarks. This is where members of Congress have the opportunity to designate where projects are going to go. And so that took a hiatus from about 2012 to about 2020 and has returned. And we've kind of watched that each year. That certainly has been a helpful vehicle for Wayne County. We've been able to essentially gain federal funding to strategic projects like our Stabilization Center, for instance, which has received $3 million in federal support, and many other projects as well. So that's what's happening on Congress. So there's a fair amount of other kind of substantive legislation that's in play right now as well. So the Farm Bill reauthorization, the Farm Bill hasn't been reauthorized in a number of years, and there is progress there. Of course, that has supplemental nutrition assistance. It has other kinds of rural development funding that are significant to many of our more rural, smaller communities. So it's a big bill, and we're watching that for the nutrition side as well. So that is percolating. There's a surface transportation reauthorization bill that we thought was going to be marked up almost immediately after when we were in DC 2-3 weeks back. That was delayed, and we're waiting to see that. That's significant here in Oregon because we're, of course, we have a transportation funding problem of our own at the state and local levels. And we're still kind of waiting to see what the feds are going to do. The Energy Secretary has floated the idea of suspending the 18-cent federal gasoline tax to help mitigate some of the inflation that we've observed. And of course, you probably saw in the news that we're at 3.8% inflation over the last 30 days. That was released this morning. So the economy's picking up. We've just, I think we're on the cusp of confirming a new Fed chair. That made it through a Senate test vote this morning. And we're also tracking a 21st century road to housing bill. So this would be a significant change in federal assistance to state and locals on housing production matters, and we're watching that closely. It has requirements for permitting reform at the state and local level, which could be an interesting thing here in Oregon. We have a lot of room on most of these bills between the Senate side and the House side, so we're waiting to see kind of how those things close. So we're actively watching what's happening. On the executive branch, we have a number of kind of rules and regulations that we're watching. One of the just really kind of trying to put the budget lens on the brief here. We're really kind of monitoring a few things. One of the more significant ones is the resource management plans for the Oregon and California Railroad revested lands. So the Bureau of Land Management manages the ONC lands. That's the yellow checkerboard that you see on this map. These are revenue shared federally managed funds for the counties that are home to the ONC lands. There's a whole history there. We have a 2016 resource management plan in place. BLM has indicated a desire to revise that on a very rapid timeline. And we had congressional action in the last appropriations process, which shifted some of the revenue sharing from 50-50 to 75-25 in favor of the ONC counties. So we're watching that. The administration has indicated a desire to conclude this rulemaking by the end of this calendar year. And we heard it ourselves from the head of BLM that there's a desire to have a durable resource management plan, meaning that it would be sustained against lawsuits and that it would be sufficient to enable private sector investment needed to sustain particular harvest levels over a period of time. And then we're watching a whole host of other rules from the perspective of our grants. I think in Mr. Mokrzycki's presentation and Ms. Moody's presentation, you saw it's no longer 60-40, it's 55-45 in terms of the state and local funding, with the larger share coming from state and federal sources. So we've seen changes in root and stem federal regulations with respect to basic grants. Even changes in the basic online SAM.gov, which is a federal identification registration process to be able to receive federal funds. We're seeing rule changes that require compliance with existing executive orders, for instance, as a proposed rule that's out there. So we're, as we have challenges in existing within conflicting state and federal legal environments, that puts counties at a particular risk in terms of just trying to manage that portfolio of grants. So we have invested considerable time keeping up with the Federal Register, seeing what various agencies are doing, particularly those that fund us to provide services, and keep an eye on that process. All right, so that's DC. So things that happen in DC, and we're all downstream from that in many respects, it's hitting Salem and Oregon. And so last year, I think I was presenting to this budget committee on initial projections as we were seeing the HR 1 process, or maybe it hadn't even passed by this time. Yeah, I think it was after Sine Die last year when HR 1 passed. But certainly to the board saw some projections about initial revenue reductions coming into Oregon's coffers. Oregon's corporate and individual income tax automatically linked to the IRS in such a way that changes at the federal level for individual and corporate taxes go right straight to how the Oregon Department of Revenue calculates those measures. And so as those reductions were seen in HR 1, that rolled straight into Oregon's fiscal standing. And so we saw some really big numbers early on in the process. A lot of uncertainty about these kind of dynamic models, which are trying to take a change in law and run that through a dynamic economy to see what then happens in terms of net collections of revenues. And so those numbers converged. We got down into the short session this year with $63 million deficit in the current biennium for Oregon. And so the legislature, through a handful of maneuvers, There was one disconnect bill in which the legislature decided to remove that automatic connection to the federal revenue code. That provided some support back to Oregon revenues, as well as the ability to move some money around, close some vacant positions, and essentially figure out where they could move money. We were able to close the $63 million deficit in the current biennium. So as we go in, and we will have another revenue forecast from the state next Wednesday on the 20th. So that will be kind of the beginning of budget season at the state level. So with that revenue forecast for the upcoming biennia, the agencies will start getting budget guidance from the governor's office, and each of the state agencies will start building their own respective budgets. We know from last year there was a significant amount of activity on the transportation bill. That was the thing that kind of really drove a lot of the conversation throughout the entirety of session. We came back in special session and moved that forward. It has now been referred to, and voters are having their say on that even as we speak. So I think most are imagining that that's not likely to survive, and so the legislature will have to think about and talk about transportation funding as we move into the next biennium moving forward. Some of the other kinds of things, it was a fairly productive legislative session for many of the matters that were of concern to our legislative committee and to our board from a staff perspective, and just kind of pulling out a few things that budget implications is often a major driver for the bills that we lean in on, and where we will attempt to have some difference. But some bills that passed, House Bill 4108 from Rep. Fragola here in the Eugene-Springfield area, passed a UGB, a voluntary annexation bill that it was ultimately limited just to the Eugene urban growth boundary. It enables folk who are within the urban growth boundary, who are not necessarily contiguous or otherwise eligible for annexation, to be able to annex themselves voluntarily into the city. That is in the county's interest to have as many of these urban properties that remain outside of the city's municipal boundaries to move over into city services. They're contiguous with city services essentially. But of course, our roads team and our sheriff has to continue to provide services for those locations. So that's a priority issue for us. And we really appreciated Rep. Fragola's work on that. We are hearing that there might be some interest to try to expand that to some other locations around the state, and we certainly have other municipalities that could benefit from that.
It was brilliant.
We worked on 4043 as well. This has been a long-standing bill that would expand court bonding capacity to enable counties who are required to provide facilities, court facilities for the state court system, to use state bonds for renovations as opposed to just new construction. So this was helpful to us, and certainly part of our broader initiative that we are working on here within our newly dubbed courthouse complex. And then we worked on House Bill 4148. This was a long-standing priority. After 2025, it was not successful. It was ultimately in 2026. And this is a permissive bill. This just says county boards and city councils may use up to 50% of any increment of travel lodging taxes for purposes of general government provision. And so that increase in flexibility was a priority. So that's what's happening. We will continue to monitor. I think, from a legislative affairs perspective, we're trying to gather as much energy as we possibly can, insights into what we might can anticipate in the 2027 session. But I think some of the things are probably clear. So the revenue impacts of HR 1 will start to taper off in the upcoming biennia. And so this is largely because some of the individual income tax measures that were in HR 1 were just short term. So there was a no tax on tips for the first 25,000, for instance. That was just for a couple of 3 years. So then that transitions out. There was a car loan interest deduction. You could buy a new car if it was American made, not pay like a mortgage sort of, but for a car payment, that tapers off as well. So some of those as impacts to Oregon's revenue position will be tamped down, and Oregon disconnected from a few of those anyway. So I think we're likely to see less on that side. We're going to see more on the kind of entitlement programs, however. So certainly from SNAP, and these impacts ramp up. So the reduction in nutrition assistance and the Medicaid contribution as well ramp up over time. So we're looking, in rough numbers, somewhere in 5 to 7 billion in biennial numbers for the next couple of biennia. So Oregon the legislature will have to make some policy decisions about how they want to move money around. I think most folk think that the legislature will try to put some additional funds into the provision of some of the social safety net programs, but that means that will have to come from other places. As we work through the process of understanding what the conversation is likely to be in 2027 and trying to prepare for that through development of legislative concepts or really partnering with our cities and others, these are the key areas that we think will be priorities. Certainly Governor Kotek has tapped former State Senator Tim Knopp from the Bend area to lead her Prosperity Council. They're working, barnstorming across the state now to develop some recommendations. We're watching that. Housing production has been a key issue for the last few years, as has behavioral health. And we anticipate those. We're seeing no indicator that those will necessarily cease to be priorities. Infrastructure funding, largely to support both housing production and economic development, is likely to be there. And then healthcare access, of course, continues to be a major issue. So we think these 5 very easily solved issues will be the centerpiece of the Oregon legislature in 2027. So with that, Chair Weber, I'm happy to take any questions.
Do we have any questions for Steve? I have one for you. With the inevitable change in the Fed chair, I've read quite a bit of stuff on it, but as a retired banker, I kind of like that stuff. So anyway, any insights, good and bad, good or bad?
I'm not an economist, Chair, so I don't have insights into. Certainly, the nominee has worked within the Fed. Was a former governor of the board previously, and I think. The question is the extent to which the Fed will retain its independence, I think, continues to be the issue of concern. I think with inflation numbers as warm as they were this morning at 3.8%, I think the fiscal impact of that for us, of course, is our labor costs are tied to relative rates of inflation. Our materials and services budgets are tied to the cost of doing business, as it were, right? And it's a real driver for the affordability of this place, but every place. So I think there's a lot of pressure on the gentleman who will be stepping into that role and to the board to try to manage that as they go into an election.
Is that part of what you're using ONC, the AOCC for as far as lobbying?
Chair Weber, Chair Seneca. So is that part?
Yeah, well, earlier we talked about using the AOCC to help lobby.
Yes.
At the federal level. Is that part of that lobbying, or are they going to be involved in those conversations?
Well, I'm not entirely sure the extent. I think as I understand it, in talking with the Senate offices, it's important to coordinate energy around the interior appropriations process. So I'm very keen to understand what that will look like. I don't know that they're going to weigh in on Fed. I'm wanting to make sure I'm answering your question. Not
Well, were you talking about timber, or what were you talking about? Maybe I missed your question.
No, mine was just with the change in the Fed chair. Just
chair.
what is that?
Oh,
Yeah, that was my biggie.
the
Or,
Federal Reserve Bank. Yeah.
gotcha.
Okay.
I thought we were talking about the timber share we'd been talking about between the Good Neighbor Agreement and so on and so forth.
Right. Okay.
I misunderstood.
Okay.
Chair Weber.
understandable. Are there any other questions for Steve? Commissioner Park? Oh, excuse me, Drew. Excuse me.
I'm just curious, at the very top, when you said that basically there's a plan to sort of obligate funding for ICE and CBP for the duration of this administration, how does that actually work? Can they obligate funding beyond a given budget cycle?
Well, Chair Weber, Commissioner, you can. Certainly, you can imagine during the Infrastructure and Jobs Act, you saw multi-year approach, and you saw this idea of almost like pre-authorizing. Typically, it's done for infrastructure or other kinds of long-lived investments, and so that's I think the concept that we've seen that used. This is almost like pre-appropriating for
operations.
operating budgets, which I think is novel. I'm not aware of that, at least in modern times, from congressional action.
And mine was just a point that you made, Steve, that with the Fed, the main concern, or what it sounded like the main concern, is the autonomy of the Fed. That goes across the economies, doesn't it? The destruction of the autonomy of what is intended to be autonomous branches or parts of government. I'm concerned about that, not just with the Fed.
Anyone else? Thank you, Steve,
Okay, thank you, Chair.
for the good information. Appreciate it. Are we ahead?
I think we are ahead, and I don't see H&HS in the hallway yet, so we
what I-
could maybe take a 10-minute break or so.
Okay, guess we shall then.
Yeah,
Did we do a speed Chester?
5 minutes, 5 minutes.
5 minutes,
Yeah.
I think.
Yeah,
Or when they show up.
yeah, okay.
Okay.
I'm Zach Evans, Assistant Director for Health and Human Services. Kate Budd, Division Manager for Human Services Division, is up here. We also have presenters Eve Gray, Director of Health and Human Services, and Katrina Inman, Assistant Director of Health and Human Services. I want to start out with thanking the Budget Committee for your time. I know that this is a time commitment, but it is a very important public process. So with that, I have an org chart of Health and Human Services. We are a mighty and complex department. Today we will hear from Human Services, Public Health, and Community Health Centers. On Thursday, Behavioral Health will present. But I would be remiss to not mention that we have 3 internal services divisions: administration, clinical financial services, and quality and compliance. Those 3 together make up about 6% of our department's proposed expenditures for next year. And then developmental disability services is an external facing division, but they will not be presenting this year. With that, looking at our current budget for this current fiscal year versus the proposed for next year, as we have in the last few years, we're seeing a revenue shift in the declining direction. Predominantly, we'll hear a lot about this on Thursday with behavioral health, but there's pieces there where the community care organizations have opted to discontinue the services that Lane Care provided, both Pacific Source and Trillium, through this fiscal year. So some of that revenue is then services are no longer being provided by Lane County, has left the budget. In addition to that, we're seeing a reduction in medical billing. So billing revenue has been down, which is impacting our revenue picture. State funding, some big items that have phased out. House Bill 4136 provided innovation funding for the community in response to the closure of the ED in the University District. So with that, Lane County Health and Human Services, we were administering those funds and providing them to different partners in the community. That funding expires on June 30th. So that's coming out of the budget. Also, we will talk about on Thursday with behavioral health. We did receive a few years ago $6 million to do residential development work in the community. That is also set to expire on June 30th. Transfers in here, there is a shift. It's not really that exciting. A lot of the transfers were movements within the department of moving resources back and forth. Going to the discretionary general fund, we do receive discretionary general fund support in public health, the family and child health program, as well as WIC, women, infants, and children. And then human services will receive discretionary general fund as well. So that's that piece. Personnel. Note with the discretionary general fund change, it does show a 12% sort of increase year over year. There was a funding change compared to this current year. About 50% of the funding for family and child health was opioid funding. And with that funding change in the proposed budget, that is shifted to the general fund. So it's sort of skewing that percentage change, but knowing that that's still a contribution of local support into those programs. Personnel, even with a small FTE adjustment down, personnel costs went up about $2 million, so we're still seeing just the cost of doing business in 2026, 27 going up. The big change in materials and services, I mentioned that the state funding was dropping with some of those services ending on June 30th. There was a corresponding change in M&S. The capital amount was moved in there for the purchase of the property in Florence for LCT services, Lane County Treatment Center services, and since that building has been purchased, the capital budget doesn't need to move into next year. And this time, I'll hand it off to Kate.
Sure. Well, good afternoon. Thank you all for being here today. Kate Budd, Human Services Division Manager. The Human Services Division's focus is really to improve the quality of life for folks across Lane County through a diversity of many different programs, from supporting children and families with parenting classes and basic needs to providing street outreach to folks who are living on the street. We do this through 5 different teams. Our first team is community action and homelessness, and this very much focuses on coordinating the different resources that are available for folks who are unhoused, as well as working to reduce the number of people who are in poverty in the community. We also have an energy and utility support team that works with all the different energy companies within Lane County, as well as partners with Homes for Good to provide weatherization assistance. We also have a workforce team, and they focus on helping people with training, connections to soft skills and resume building, as well as helping people actually enter in and be supported while they're starting a new job. Next team is housing stability, and it's providing rent assistance to folks who are unstable in their housing and may be evicted, as well as wildfire survivor support programs for people who survived the Holiday Farm fire. And lastly, but certainly not least, a veterans team that has certified veteran service officers supporting veterans and their families to access benefits through Veterans Affairs, and also to provide advocacy when it might be that something's falling through the cracks. So a few of the key initiatives that we're focusing on for the next fiscal year include growing our health-related social needs housing program. And this is one of the programs that was made possible through the 1115 Medicaid waiver, where folks who receive Medicaid or Oregon health plan may be eligible to receive up to 6 months of rent assistance and up to 2 years of supportive services. And as you can imagine, the need is very high. And so HSD created a team to help support this need, and it is on a fee-for-service basis. And so because we want to create a self-sustaining team, we want to continue to grow so that we are bringing in the needed amount of money to sustain the program moving forward. We also are working with our workforce team to integrate their services within our homeless crisis response system. As many of you are aware, there's lots of changes happening at the federal level in policy. One of them being that folks who are engaging in housing programs paid for by HUD will need to engage with a work program, work itself, or volunteerism if they're able to work. And so we want to make sure that folks have the resources they need to be able to engage in workforce services so that they don't lose their housing. We're also, we just in fact implemented a cost sharing policy for our homeless management information system. In that previously we didn't have a mechanism for our providers to actually understand, what does it cost if we're going to add 3 new users to our system because we receive grant funding from the federal level. And so this cost sharing policy allows us to say, yep, it's going to cost, $10,000. Please add this into your grant application to the federal government, to the state, and then should they be awarded, then there is built-in funding to be able to sustain our system with the growth that the funding would bring to the community. We're also focusing on sustaining the shelter beds that are currently supported with the statewide shelter funding. It is very much a priority of the state, and so that is a focus of ours as we plan for the next fiscal year. And then lastly, we contract with 20 different agencies across Lane County to provide over 70 different programs. And so as you can imagine, we continue to see a need for training and technical assistance to support the administrative infrastructures of our agency partners, as well as the programmatic infrastructures to make sure that they're following all the guidelines related to the funds. And so we have a focus
focus on increasing those supports as we look to the next fiscal year. So as we look at the next fiscal year regarding staffing, HSD is planning on seeing a reduction of 4.15 full-time equivalent staff, bringing us down to 52.8 full-time equivalent staff in total. That reduction comes from 3 fewer community service workers, and that there would be a reduction in those providing street outreach. We have a rural outreach team where, unfortunately, the funding that we had received through Lane Community Health Council is predicted to end at the end of this year, and so those positions would end. And then we also have a coordinated entry CSW, and that position would end as well. We would see a 0.8 FTE reduction in our workforce program, and that's due primarily to retirement, and then 2 staff who are reducing their overall FTE as they look to the next year. And while we're seeing some reductions in programs or complete endings of programs, we do have some growth. I mentioned the health-related social needs program and the need to grow in order to sustain, but we're also seeing growth in our wildfire survivor program. We're fortunate in that Oregon, I believe, is seeing that we are doing strong work and continuing to engage in survivors and help connect them with the different resources that are available in the community. And so we'll be able to continue our work with the state to serve as an access point, and then actually are in negotiations right now with potentially bringing on a housing navigator, which is exciting. So we are seeing, if we compare this fiscal year to next fiscal year, a reduction in the budget as far as state funding by about $2 million. And then in our total budget, if we reduce our budget by the fund balance, we're actually seeing about a $4.5 million reduction in total. So the 2 service options that you have in front of you include one for our Veteran Services program. We have a total number of 6.75 FTE within that program, and the funding that we receive from the state has a maintenance of effort requirement. And that basically means that we need to sustain the amount of local funds that we've been providing to Veteran Services in order to draw down the state funding. The impact of our Veteran Services program is amazing in that if we look at the fiscal year 25 for the full year, the team was able to support veterans and their families to bring in over $10 million in either one-time allocations or ongoing monthly payments from the VA. So very impactful and very important work. We also have a service option request for our homeless system transformation and Human Services Commission funding. The homeless services transformation is from a report a few years ago where an agency came in, took a look at our overall homeless crisis response system and very much pinpointed opportunities where there could be greater efficiencies and effectiveness and growth. And so it created a few key positions that support our coordinated entry access, which is basically an entry point for folks who are unhoused and have very high needs, are chronically homeless with a disability and have been on the street for over a year, and helps connect them with the available housing programs that exist within the community, pointedly permanent supported housing as well as rapid rehousing. Also provide staffing to support the Poverty and Homelessness Board, which is a requirement of being a community action agency through federal health and human services, as well as a requirement of being a continuum of care, which is a distinction for HUD. And so staff provide support and staffing to that committee, as well as the 6 different task groups that have been created as a result of the newly updated and adopted Poverty and Homelessness Board strategic plan. Secondly, within that service option, there are funds for the Human Services Commission. And this is an intergovernmental group that is supported by Lane County as well as the cities of Eugene and Springfield. And each entity brings in funding to go into a unified pot of dollars. And those dollars are extraordinarily valuable because firstly, they help meet match requirements that particularly federal dollars that we draw down for housing programs and outreach and other supportive services have that need to be provided, a 25% match for every dollar that we bring in. The Human Services Commission also provides admin to many of our contracts, recognizing that what we're receiving from the federal or the state level may not adequately meet the needs of the agencies that we're working with. And then it also helps to provide funding for gaps that arise in that it feels like every year there are gaps that arise, needs that are unmet, that are catastrophic, really, if we're not able to help address those. And so these dollars are invaluable. I will offer, I don't predict that the other jurisdictions would provide funding should the Lane County HSC funds not be able to be matched within that pot.
Chair, may I ask a timely question on that?
Sure, please.
Based on, in 1995, March, I sat in this room for the very first time in an HSC meeting. At that time, City of Eugene provided about 3 times the amount that this Lane County provided. What's the ratio today?
So I can offer this year, the City of Eugene provided $1.1 million.
Less than Lane County provides.
Correct.
Okay. And now, there are all kinds of asterisks and bullet points into that I could state out loud. I'm not going to, out of decorum, but...
And I will also offer City of Springfield offered $150,000.
Can I ask,
Go.
since we're peppering Kate with questions.
Sorry.
Beck, the loss of the 3 street outreach workers, my question is, leaves us with how many? And then in veteran services, do they have street outreach workers within veteran services specifically doing street outreach for that population? So basically, what is Lane County's presence for street outreach overall?
So at this point, we would have just one community service worker within coordinated entry who would be engaging with folks on the street for coordinated entry. Unfortunately, we wouldn't have any other programming looking at the next fiscal year for street outreach.
And is any part of veteran services funding go to street outreach? And is that a separate position if so? Or does that help offset the cost for our, what will now be 1 person? Or?
It doesn't, and it is completely separate, but veteran services doesn't provide street outreach. There are other agencies, and we do see a growth in the peer support street engagement that we're seeing from the City of Eugene.
Thank you.
For clarification, the City of Eugene's contribution to HSC is 1.1 million total,
For the Human Services Commission.
and East Springfield's 150,
Correct.
and then Lane County's contribution 104. That's what 3.4. Okay, so just wanted to clarify that.
I'm biting my tongue.
Carefully don't hurt yourself.
Yeah.
It already hurts.
So looking at our budget pie chart, what you see here is that the majority of our budget is from state funding, nearly 50%, then federal at 26%. I will offer that because we're in the middle of a state biennium, we are fortunate in knowing our state allocations at this point in time. That was very different than where I was a year ago. And when we look at the federal allocations, the presidential budget that was recently released, actually it zeroes out all of our funding from the federal level. And that did happen last year as well. And in the end, after Congress passed its budget, we actually saw that all of the funding sources at the federal level were either sustained or increased. And so I will look to that historical perspective thus far and remain hopeful that we will receive at least a sustained federal level of funding. We have 10% from transfers, and so that's general fund, as well as we receive a small amount of money from, and it's a part of this City of Eugene Human Services Commission allocation. A part of that is opioid funding from the City of Eugene, which goes to Lane County, Lane County Treatment Center, thank you. And they then provide that, it's about $400,000 to the Human Services Division. So just some creative accounting there. The fees are the health-related social needs funding. At local represents the straight to the Human Services Division allocation from the City of Eugene and the City of Springfield. And then the other represent the Coordinated Care Organization as well as the local utilities for the utility program. So if we dig deeper into the impact of these reductions, the reduction of total revenue very much is related to the use of rollover funds for this current fiscal year. That last year we had a number of resources that we could roll over, and it helped soften the blow to our programs. So that included funding for shelter, funding for long-term rent assistance, and a few other resources. And so, of course, those dollars have been spent, and we just have dollars that were allocated for this biennium looking to the next fiscal year. The revenue offsets include our health-related social needs program, and that we continue to ramp up and get fee for the services that we're providing, and then that homeless management information system cost-sharing policy that's now been implemented. So looking at the reduction of programs for fiscal year 27, that includes ending the rural outreach program due to Lane Community Health Council needing to get their agreement was through the end of this year. And at this point, there aren't additional dollars for the next year. We are needing to end our FUSE program, which is frequent users of system engagement. And this was a very strong program in that it received a 5-year grant from the Substance Abuse and Mental Health Administration at the federal level. That 5 years has come and gone. We have kind of struggled it along for the last 2 years in partnership with our coordinated care organizations, but at this point we don't have a further commitment from our coordinated care organizations and don't have the ability to fund those programs ourselves. So those will be ending. Part of the FUSE program includes street outreach. The other part is shelter. And so when we look at the impact to shelter and 30 fewer beds, one part of that is 10 shelter beds from the closure of FUSE, and then another 20 shelter beds due to Lane County not being able to contract with an agency due to a corrective action plan. And so while we never want to see any emergency shelter beds lost, these reductions at least are for other factors rather than just not having enough money for those particular shelter beds. We also are seeing a reduction in the long-term rent assistance funding. This year we used some rollover to be able to keep the program at the same level. Next year, of course, we don't have that rollover, and so we'll see a reduction of 26 households. I will offer that we won't see that people are going to fall into houselessness, for example. It's simply that we won't fill those particular vouchers as we look to the next year. And then lastly, there's a reduction in the STEP program, which is one of our workforce programs that focus on people who are unhoused. And that was primarily a reduction in staffing. And so we'll see 20 to 30 fewer households as a result of that reduction. The numbers that I mentioned already, but one thing I haven't touched on yet is we also have fewer client support dollars. And so that's really connected to our rural outreach and that they provide basic need items to folks who are on the street. Coordinated entry also provide basic need items, and there's less of a budget for that, as well as the STEP programs, less of a budget to be able to provide training and clothing and other support needs for the clients. So looking at our expenditures, the 60% of our expenditures are for provider contracts, so go directly to programs within our community. 11% is for client support, and so that includes providing rent assistance or basic need items or training to individuals seeking work. 7% admin, 17% personnel within the Human Services Division, 2% operations, and then 2% for our homeless management information system. And then lastly, just digging in a bit further, we did see increases in expenditures for central service costs within both admin and health and human services, as well as costs related to depreciation of county-owned facilities within HSD. We saw decreases in telephone and TS costs, as well as divisional administration. And then in total, a reduction of about $1.2 million when we're looking at the shelter operations, long-term rent assistance, and outreach costs that will not move forward into the next fiscal year. We have many future considerations, especially related to the federal level. As I'm sure you're well aware, there's many policy changes that either have been implemented or will have been proposed. We are concerned about the sustainability of our permanent supported housing programs, recognize the significant policy changes that have been proposed within the continuum of care funds. And so we're taking a close look at that and working with the state to try to identify flexible funds that may help meet the needs. We're also seeing that administrative costs are increasing, particularly with our providers, but also within the county. And we're not seeing the administrative rates increase either at the federal level or the state level. We do continue to see more detailed and prescriptive requirements coming from the state level regarding all the different funding sources that we receive, just less flexibility, and that is particularly true within our shelter funding from the state. We do, within HSD, have a reserve fund of approximately $440,000. And while that can fill in gaps, if we think about the uncertain federal dollars, for example, that is in the millions. And so that reserve would only go so far, and the impact would be enormous if we didn't get those federal dollars. And then we're also thinking about fiscal year 28. It is noted that the continuing service levels of homelessness funds at the state level are cut in half or just don't exist as we look to the next biennium. And so while we're facing cuts this next year, they may be much more significant in the following year. Opportunities, firstly, advocacy and just greater coordination and collaboration with our partners and jurisdictional partners. And we're pleased to have an advocacy task force within the Poverty and Homelessness Board, for example. We're very pleased to have the cost sharing policy in place for the homeless management information system, and then also the growth within the health related social needs program. We do seek to preserve the programs that are most impactful within our system whenever possible, and so that is a focus that we continue to carry with us. We are continuing to right size internally as well as with our partners to be cognizant of the funding that is available, and then also to align internally with the staffing and operations needs within HSD. And then lastly, to pursue more stable and flexible funding, and also to encourage and help to equip our partner providers to do the same thing, recognizing that government certainly can't do it all. Any questions?
Commissioner Farr?
I have a lot, Kate, but for the purpose of this meeting, there's no use belaboring it. There's not much that we can do as a budget committee to forestall what you're outlining. Nobody's looking forward to this presentation, although I think you've done a superb job of minimizing the impact of what could have been far more devastating than what we're seeing today. It's really heartbreaking when you say on the strategic response, protect high impact programs to ensure effective targeted resilient systems. In the same breath, you say we're cutting fuse. So the frequent user system engagement is nationally acclaimed for a relatively small amount of money. But my question, and this is the only question I'm going to ask, is that was a CHC funded in the last few years, the Community Health Council, which was Pacific Source. They're gone. Trillium's still here, taking over as many of the responsibilities of the Pacific Source. Has Trillium been talked to about potentially? They were in the early days that Trillium was one of the proponents of the very first years of Fuse. So, and I don't know, you don't need to answer that out loud, but I would hope and expect that they take an eyeball at that and see what is effective and what they've been instrumentally a part of historically.
And I'll just offer, we have definitely been in conversations with them for a while. At this point, we have no commitment for dollars. I know that there is kind of one more potential funding source that I'm in the queue for through Trillium, but again, at this point, no dollars have been committed.
And again, there's nothing much we can do as a budget committee to forestall some of the things that you're outlining here. However, helping to provide a uniform gut level response as to what this is doing to our systems that have been most effective, been nationally acclaimed. That when any of us goes to Washington, D.C. or NACO, they want to hear about our programs. Well, we don't like the thought of that. So again, nothing more than moaning out loud. But it's not a time for hand-wringing. It's a time for looking at opportunities and trying to find strategic responses, which I believe we're in the very best hands we've ever been in right now for that.
I was just going to say, I appreciate what you just brought up, and would just say what we all can be part of is the opportunity of the advocacy and greater collaboration. That includes us, the members of this committee, can be some of those advocates, exactly as you were talking about. And then I only have one other question. It's actually going back to Zach's presentation. When you talked about billing revenue being down, can you just talk a little bit more about, is that reimbursement rates have dropped? Is that our capacity to manage billing in a timely way because we're losing people, and so therefore we're sort of...
I think we answer that
Yeah.
partially during the CHC
Yes.
discussion, and then I think the other part will be during behavioral health on Thursday.
Okay.
If that's okay.
But yeah, absolutely. I want to hear more, because little bits and pieces we've talked about at our board, but not in budget committee, and Director Gray's talked about that sort of catch-22 of we reduce capacity on the staffing side means we're not maximizing our ability to pull in the revenue that's available to us. We're leaving money on the table. It's basically what's happening. When you say billing revenue is down, that's sort of what's happening, right? Okay, thank you.
Zach wanted me to mention the budget ad memo, and simply we received the allocation from the state for our statewide shelter program funding, and received $1.1 million more than we did this year. And so that's fortunate, and pleased for additional dollars. And so that, with that addition of dollars, that's where we stand at a reduction of 30 shelter beds.
Speaking of advocacy, sometimes it works.
On those 30 beds, I understand that 10 were from the fuse, but the 20 you said was due to corrective action. Can you expand on that a little bit?
Sure. So when we monitor programs and agencies, when there are issues that arise, so it could be, maybe they're not tracking their dollars and providing the adequate backup that's needed. Maybe they had gotten funding ahead of the program and then needed to pay it back throughout the year, but didn't. And so whenever there's issues that arise in that monitoring, we do a corrective action plan, and it has expectations as to what they need to do in order to reconcile those issues. And the agency, it hasn't done that, and so we're not able to contract with them.
Okay.
Anything else for Kate?
Thank you.
Thank you.
Thank you.
Thank you.
Hey, good afternoon. My name is Katrina Inman. I'm an assistant director here at Health and Human Services. I'm here on behalf of Brian Johnson, who is our new public health administrator, and he has a planned vacation prior to these dates being set, and so I'll do my best to fill in, and Zach will be my team in that. So just want to briefly go over the work that we do in public health. It is a very diverse amount of work that we do. I want to lift up that the community health assessment work and the community health improvement plan work that happens within our public health division. We have a very robust nurse home visiting program under our family child health work. And we also continue to do our emergency preparedness and response work. Our environmental health team is out doing all of the food, pool, lodging, and water inspections. We have our vital records team working on birth and death certificates. We have WIC, and then our communicable disease surveillance, control, and reporting program that's working on things like sexually transmitted infections, HIV, tuberculosis, and now a lot of vaccine preventable infections as well. As you can see, we have a staff of about 90. We are people powered, as Jocelyn Warren used to say, our previous public health administrator. And I do want to point out our general fund and our nursing home visiting programs and our WIC programs. So some key initiatives for this year. I want to highlight some work within our communicable disease team. We're really focused on getting out into the community, meeting people where they're at versus operating more in that clinical setting. So that's been huge. Again, I had mentioned that we are preparing and ready to support those vaccine preventable infections. We've seen more pertussis or whooping cough in our community, and we're seeing just an increase in measles cases, and so in our state and in the nation, and so we have to be prepared to respond to our community needs there. This has been a really big year for Live Healthy Lane, and I know our commissioners have been briefed on that. This is a collaborative work that happens with our CCOs, and Kaiser is at the table along with a lot of other partners. So this year we embarked on our community health assessment and our community health improvement plans. That was a big undertaking that was deeply supported by our community, and lots of engagement happened on that front. Public health modernization continues to be a key focus for us. Now, this was a state initiative to really rebuild our public health system, getting it operating in the way we need to do that. And the idea was for continued funding to come in to support that. Unfortunately, we did not receive any additional funding in the last legislative session, but we continue to advocate for this funding, report on this funding, and lift out the importance of that work. And then expanding our family child health programs, we continue to build out our Family Connects work, which is our universal home visiting program. Do you all know that we have universal home visiting here in Lane County? We do, and we need your help getting the word out. And we're continuing to expand that. It's a wonderful way for us to connect with lots of families in our communities, allowing us to provide that deeper and more robust home visiting programs like Nurse Family Partnership when families may need more support. We also have our Nurse Family Expansion program, and that allows us to see a broader array of community members, expanding that eligibility. Unfortunately, we have had a lot of changes to our services this year. I want to start by talking about our mobile public health team and that program closure. Zach mentioned that we had House Bill 4136, some health transformation dollars that allowed us to trial some really exciting work. Unfortunately, we were unable to find a sustainable way to continue that work. So that has ended. We also have our Public Health Reserve Corps, and we talked about this morning at the board meeting, and we had hopes that the EPA grant would continue to fund this work, and with the loss of those federal dollars and not receiving that award, we were unable to sustain it within the county. We're very lucky that St. Vincent de Paul has taken on that program. The state allocates some public health modernization dollars directly to our community-based organizations, and they receive those dollars, and we'll continue that work, and it will be a deep and strong relationship and partnership with Lane County. We need them. That volunteer need really grew out of learning in COVID. We've also lost a full FTE of an epidemiologist, and that is really a core infrastructure piece of our work in public health, allowing us to monitor, plan, respond. So that is a big loss to our public health team. We've had a number of staffing reductions, the climate change position. This is another result of the EPA grant. We've had some reductions in our family child health team, and some part-time nurse work in our communicable disease team. And then lastly, we previously had 2 public health program managers, and we have eliminated one of those positions. Brian Johnson was previously in one of those positions, so we have a vacant position right now, and Brian needs a little time to figure out the leadership structure that he needs to really support public health. So more to come on that. And I think it's you, Zach.
Thank you. And then one thing I want to mention, tying into this slide, but also with the last one, public health finished fiscal year 24-25. So June 30th, 2025, they had 105.63 FTE. The proposed budget is a smidge lower than 90. So that's in a year, a change of about 16.35 FTE and rounding up to about 16%. So we have seen some upheaval tied to the loss of the EPA grant as well as flat state funding. So with that, a majority of the resources in the proposed budget for public health are with an intergovernmental agreement with the Oregon Health Authority. As state funded is the largest portion. Fund transfers, that's where the general fund, discretionary general fund at $1.8 million proposed in the next year's budget, as well as a $731,000 sort of contribution from the Lane County Treatment Center in order to support the communicable disease program, as well as support a portion of WIC. Smaller portion of that being federal revenue, fees and charges is mostly the environmental health work, as well as vital records. Same thing with licenses, permits is predominantly environmental health. The administrative charges, their public health administration has a cost allocation plan similar to other divisions within Health and Human Services, as well as Lane County Central Services and Lane County Technology Services. The interdepartmental reimbursements is the video lottery proposed budget of video lottery dollars in environmental health to help us continue to maintain reasonable fee increases when we go through that process instead of fees jumping to 8, 10, 12%. The video lottery money is helping us flatten that curve. And then the local revenue is 1 year of the 3-year grant. It's miscategorized up there, which we will fix, from the Nurse Family Partnership Expansion Program. So overall, in the proposed budget, there's a rounding up a 3% decrease in operating revenue and a 6.2% decline in total resources. What's driving the declining revenue is there's a decline in tobacco prevention money, a decline in funding the Healthy Families programming, as well as the sunsetting of the House Bill 4136 project. We're seeing a decline in fees and charges. There's a decline in death certificate fees that we've been seeing that trend over a period of time, which is hitting the Vital Records program, as well as medical billing. There has been sort of recalibration of the Family and Child Health program, that the Nurse Family Partnership is hitting caseloads and really moving the needle forward with that work, but we're seeing a sort of a pushback or a pullback in Family Connects as well as Cocoon. So they're having sort of a once growing one program within a program, I guess, is increasing their targets while the others are having a little bit of some trouble. And then, well, the last one is Lane Community Health Council had provided funding to launch the Family Connects program, and that funding will be exhausted by the end of this fiscal year. So looking at, to quote Katrina, to quote Jocelyn, looking at expenditures, public health is people powered. About 60% of their proposed budget is personnel costs. Intergovernmental agreements and agency payments are about 20%. And I know that this does not add up to 100. And then Medicaid match, so the required match that we have to do to receive Medicaid revenue in the Targeted Case Management Program in Nurse Family Partnership. General fund supports the match. It is a requirement, it's 10% of their expenditures. So it is a large financial commitment for Lane County to hit that program to then receive Medicaid funding from the state. With intergovernmental agreements, a lot of those expenditures are subcontracts through the Coordinated Care Organization Prevention Plan. So Public Health creates a prevention plan, works through with our community partners as well as the CCOs to approve what's in the plan, and then Lane County, we subcontract out some of that work to hit the measures in the plan. Looking at budget overview and expenditure changes, we're seeing about a 2% increase in personnel services, which is very close to what the department is seeing as a whole, and then M&S decreasing a small clip. And then, as I mentioned, compared to the current budget, there's a small change in FTE, but when we look back a year, it is substantially higher. Back to you, Katrina.
Okay, I didn't know I had this slide, but here we go. Okay, so we do have 2 additional FTE changes in family child health. And just want to point out, as Zach did well, that we're just seeing a change in being able to meet some of those thresholds. So for Family Connects, we're not getting the referrals that we had hoped to, and we're working really hard on that front. We used to be able to be in the birthing center at Peace Health, and they changed their protocol, and so we're not allowed in there anymore, and that is dramatically reducing our referrals. So we are working on a lot of conversations to support continued partnership, because this is a really incredible and state mandated project program.
Do you know the genesis of that? Where did that decision come from?
I
And is there
believe
an opportunity to?
Yeah, it's HIPAA related. I think there's concerns that having our staff in there could be a violation, is my understanding, right? You've had more conversations with our executives.
They had a new interpretation. And despite confidentiality agreements, felt that it was not appropriate to have our staff in there. But that is the time where families realize that they need a nurse to come and visit them with this brand new baby who just kept them up all night. So it has been very difficult to get the referrals without the partnership of the hospital.
We need a newer interpretation.
We need to reinterpret.
We have some continued conversations going, and we do have a pediatrician who is a champion for us in this work, who works at the hospital. So our fingers are crossed, but this has been a difficult one for us to maneuver through.
But we're continuing to move forward on that. I'll also shortly talk about some federal funding that we're receiving in our rural communities. So we're going to be doing a lot of marketing to get the word out. I think there's a ton of opportunity there. And so we really, this is our year to dig in and make this program work, because right now it's not meeting, we're not getting the referrals, therefore not getting the billing that we anticipated.
Do you have a sense of how one-to-one is that reduction relative to losing this opportunity with Peace Health?
So we are cutting nurses, we're cutting support staff because the nurses' loads are full enough, and right now they can do some of that support work. So we're set up to get more referrals and continue to grow that program. It's also a new program for us, so we're figuring out the personnel needs that we need to be able to operate it. But I don't know one for one. Commissioner Traeger, we could look into that more. And then we've seen a slight increase in WIC services. That's positive. Okay, just a few things to think about as we look forward into the coming year. Again, modernization, that will kind of be a continued advocacy point for us. And in the next legislative session, we'll continue to try to advocate for actually increased dollars would be ideal. And I know that's going to be hard in our current environment. There's also some discussions about vital records expansion. So right now you can get a birth certificate for the first 5 months and 28 days after a kiddo is born. And there's a look to extend that to the first year, which is very helpful for new families and would increase our revenue. I also want to mention that the public health community continues to talk about the alcohol tax as mechanisms for supporting prevention. We haven't seen an increase in beer since 1977 and wine since 1983, so we haven't seen any increases there.
Though we try every year.
I know, we do. I also want to lift up the Rural Health Transformation Funds. These are the federal dollars that I was alluding to. There is dollars coming to Oregon. Some are competitive, some are allocated. We're very lucky to get some of those allocated dollars to public health. Now, the tricky part here is they are essentially one-time dollars, and we know how hard and harmful that has been for us in public health. So we're trying to do our best to find ways to do work that we can sustain. So right now, that will look at some expansion of our staff work and our prevention team, spending more time in our rural communities. This is doing things like suicide prevention, overdose prevention, alcohol and drug prevention. And then we are going to employ 4 community health workers, and that will all happen through one community-based organization, one behavioral health provider, one primary care provider, and a school district. And so we're trying to create a sustainable funding source there through the billing opportunities. And we have technical assistance through our billing hub here in Lane County to provide that technical assistance and support. This is also potentially really helpful as we look at the changes to Medicaid and the unique opportunity for our community health workers to connect with folks that haven't been connected to. So there's a little glimmer of hope in this moment. We also have some funding ending, a 5-year CDC work workforce development grant that ends in November 27. And then we have some one-time opioid funds. Also, as I talked a little bit about Medicaid and changes there, as you all know, our coordinated care organizations in this state, it's a fragile environment. We just saw one of our CCOs and business here in Lane County as a CCO. One of the ideas on the table is to eliminate the quality or change or eliminate the quality incentive metrics. Those are funding mechanisms that we rely on in public health. They're very important. So we are watching that closely and advocating where we can and with our CCOs. And then reserves continue to be a struggle in public health, and we realize that those are not where we would like to see that. I think that's all we have. Yeah, go ahead.
Yeah, with that, we do have a budget reduction memo for committee's consideration. It is tied to the 2 FTE that Kachina had mentioned. So the memo goes in a little bit more detail that we're seeing almost $400,000 revenue change reduction there, $139,500 from Trillium. Trillium, since at least 2012, has funded some work in family and child health, and they have notified us. We are still in conversations, but conversations right now are looking like they will not continue that support. So that support, in that case, we are reducing that from the budget. The other is an estimated $250,000 due to declining or new projections that are showing declining medical billing. To sort of offset this, there'd be $107,000 usage of reallocating the CDC infrastructure grant, the one that Katrina mentioned that expires in November of 2027, to use this to propose to use in next year's budget, as well as the personnel reductions to have that balance. Yep.
Any questions? Otherwise, turn it over to Director Gray.
I wish I was coming bringing you good news. The situation feels pretty bleak in Health and Human Services right now in a lot of different areas. So we'll move on to the community health centers. I'm gonna rush through some of this, just knowing that we are short on time, but we have a variety of services within our medical home, including, of course, primary care, dental, assistance with OHP enrollment, community health workers, pharmacy, behavioral health, and just a few specialty services. You can see the resources and the requirements that we had put into this budget. I will share with you that some of our financial projections when we created this budget have changed pretty significantly due to some failure of a certain amount of revenue to materialize. So I don't have specifics on that to share with you today because we are still working through that. But there will be some changes that will need to be happening to this budget to reflect in this fiscal year problems with revenue that I can drill down on with you however you would like. Some now, probably more later. But at any rate, this is a moving target, as it always is in a place where you're reimbursed up to 6 months after you provide the service. Okay, so we have been working really hard to stabilize primary care. This is really hard right now in health centers. Everywhere that we look, revenue is declining. So we are losing patients covered by Medicaid. And there are a couple of ways that this is happening. One is that we have had some revenue that is consistent that we receive every month through capitated payments or per member per month payments. We will be losing those capitation payments on January 1st for people who are in the Healthier Oregon program. And that is individuals whose immigration status is not congruent with how the federal government would like to reimburse. So we are looking at a significant reduction in revenue. Potentially, we're estimating somewhere in the neighborhood of 10% of our patients on capitation right now we could lose our capitation payments for and only be paid fee for service at a lower rate than we are paid today. We also are looking at, of course, HR1 and work requirements hitting. That is actually going to be a little slower in Oregon. It's going to hit us much more in the following fiscal year, fiscal 28, because of our Medicaid 1115 waiver that maintains 2-year redetermination. But we are going to have some people who start falling off of Medicaid as of January 1st with the federal changes. We also had a state reduction in our quality incentive payments. We also have pharmaceutical company attacks on our 340B program, and we are seeing declining revenues there. So we are in a situation where our expenditures are rising fairly rapidly. Our materials and services have gone up a lot related to tariffs and fuel surcharges this year. Our personnel costs continue to increase, and our expenditures are headed in a direction of some real significant decreases. So we are working hard to stabilize, and there's going to need to be some really continued dialogue that we're having pretty frequently, probably over the next fiscal year, on how the situation is shaping up for us in the CHCs. We are trying to lean into some of the MAHA-related programs in nutrition and lifestyle medicine. We have submitted a grant. There's another one that was released and pulled back, we think for White House review related to their priorities. So once it gets re-released, we will see if it still is something that we are able to apply for. We're trying really hard to keep people on health insurance, but it's hard. The complexity for folks to stay on their Medicaid is going to get harder and harder over the next year. We are doing a Rural Health Transformation Program grant to get the dental clinic at South Lane up and running, to do the startup costs there. So that is one glimmer of hope. We're trying to do a Medicaid change in scope with the state to re-look at our reimbursement rates in hopes that we can negotiate higher rates with the state. That is one other potential glimmer of hope. We've got, and we are looking at expanding pharmacy services. This is during a time where 340B is under attack, but it is still a very important revenue source for health centers right now. So we're going to see what we can do to lean into that revenue source as long as we possibly can. And enhancing utilization of our EHR features, because we've got to do some things to reduce the administrative burden on providers. We are going to have to be increasing workload over time in order to manage the fact that we just don't have the money that we have had in the past, and it is anticipated to be on a declining trajectory. Okay, so this year we did reduce almost 31 FTE, mostly in vacant positions. We consolidated 2 primary care clinics, and we worked really hard to negotiate with our CCO better rates. We were able to do that with Trillium. Unfortunately, we were assigned thousands fewer patients under Trillium than we had under Pacific Source. And we did not anticipate the reduction in the volume of patients when we negotiated the rate. So that was an impact for us. I see your confused look. Some of that is related to a Native population who were not allowed to be automatically assigned to a CCO, and the administrative burden for them to choose a CCO at times had them waiting hours on hold with the OHA, and they gave up. So I know the OHA has done a lot of work to try to make it easier, creating an email address, but we still have not seen the resurgence of folks who are tribal members coming into CCOs. We also, for whatever reason, there were folks on Pacific Source's roles that OHA did not assign to Trillium. We don't have all the answers on why that is. We also have documentation that we're seeing thousands of patients for Trillium who are not assigned to us. And we are continuing to work with Trillium to try to get them assigned to us so that we can be paid for our work. But there are some major data issues that have happened in the transition that have also impacted our revenues.
Is that an opportunity, continued opportunity working with OHA?
That one is a Trillium conversation that we're continuing to have, that I understand we'll get our next update from them next week.
And is the Tribal Nations folks an opportunity to work with OHA?
Yeah, and I think, at this point, they have made an easier process, and it's a matter of getting the word out, and then having folks, for whatever reason, some individuals may not want to choose Trillium, they may prefer to choose Open Card.
So, taking what Director Gray mentioned, we are heavily funded by one way or another the state and federal government. So we get a Health Resource Service Administration grant, which we applied for the recent round of competition. Our current grant ends at the end of this month, so hopefully we get notified soon of what that means. 340B revenue is a major revenue source and also subject to some scrutiny and federal legislation changes, and then Medicare, Medicaid billing, CCOs, and then a transfer from our lane care reserves of investment earnings. Okay. So we are seeing, with that, a slight decline in proposed revenue budget. We have been significantly.
This is, just real quick, this is for the older numbers.
Yes.
This will come to you again with even lower numbers as soon as we have been able to work through that.
So we're seeing that. We're seeing our expenditures continue to outpace the growth of our revenue. And we are putting a lot of eggs in a basket of a Medicaid change in scope application with the Oregon Health Authority. With expenditures as proposed, knowing that further refinement and further sharpening our pencils is needed, $35 million personnel services budget for the 200 plus FTE that are there, almost $18 million in materials and services, with our significant items being, not surprisingly, tied to medication and medical supplies, and some consulting expenses with our electronic health record, and then some internal services costs just between TS, central services, as well as the HHS department support and facility usage. And the department support is not only Health and Human Services Administration and Finance Division, it's also our clinical financial services, which is our medical billing, and our quality and compliance, which focuses a lot on compliance with HIPAA and medical risk and healthcare risk items and healthcare compliance items.
And EHR support.
And EHR support. We're seeing an increase as proposed in our personnel costs as well as in materials and services. The increase as proposed, though, knowing that we have, well, I don't know the timeline on the 31-ish FTE that were reduced. So as proposed, we can come back with that, but an increase in personal services and M&S. And we did a strong look at trying to align our medical supplies budget to actual spending.
Okay, I think I've already talked about most of this. We are working really hard to continue to serve our community, and it's getting really hard to serve our community. So, like I said, this will be a continued dialogue, certainly with the Board of Commissioners, and I'm happy to answer any questions if the Budget Committee has any that you would like to send for us to send you information during this process based on where we are today.
Questions? Well, thank you, Eve and Zach and Kate and Kachina for the presentation. Like I said, it's a little tough, obviously. And again, the commissioners are much more involved than I am, but this, from my point of view, just that. I mean, I don't even know how to respond, to be honest with you. It's just needed services and Commissioner Mark.
Well, it feels like a kind of a perfect storm this year. Federal reductions, increased costs, and Pacific Source leaving the market.
And state reductions.
Federal / state is, yeah. So, I mean, it all happened at the same time, creating an immense amount of tension, not for me, for you. So,
Yeah.
So as much as we can absorb, we certainly can, but it's remarkable what was done to this. say across the board, I know that everything's what that is to us.
I should open that.
All right, thank you very much. Looks like we're taking a break now, 3:35, so 14 minutes.
All right, there are snacks and drinks out in the area where
So we will move on with our next section. Mr. Hurley, how are you? Haven't seen you for a couple of days.
Good to see you. All right, so I'm Dan Hurley, I'm the Public Works Director, and I'm here with Jeff Orlandini, our Waste Management Division Manager. And I know you've already heard about plenty of challenges here today already. These are challenging times for the county, and unfortunately no different in Public Works and Waste Management. I'd like to be bringing you some positive news today, but unfortunately that's not the case. The challenges in Waste Management Division at this point in time are so significant that they warranted their own presentation. So we will be talking about just Waste Management here today, and then I'll be back with 4 of our other divisions in Public Works tomorrow. At Waste Management, there's a variety of forces, political, financial, that are converging at this moment that are facing a significant deficit for our division and unsustainable. And we're going to need direction, and we'll be looking to you for your guidance and advice to help us work our way through this and weather the storm. And I'm hopeful with strong leadership and wise judgment and some creativity that we can find a way to keep things moving, to provide the essential services at Waste Management that we do. This presentation will be a little unusual in that we're a little ahead of the board in making formal recommendations towards a decision. What we've done instead this year is to create a menu of options. We have Tara Kuehl, our Waste Management analyst, with us today, who's spent a lot of time doing different scenarios and analysis for you to consider. So Jeff will take you through some areas where we can try to get to some reductions or some increases in revenue. And then we'll be looking for you for some guidance that we can take to the board and then work towards some final decisions. With that, I'll pass to Jeff.
Okay. Okay, so yeah, I'm gonna start with talking hopefully pretty briefly about just what we do and how we do it, and then we'll get into the kind of menu of options to get us where we need to be. So division's almost 95 full-time equivalent. A little asterisk by the revenues because the budget, as the budget documents are presented, shows us balanced, but they have 2 placeholders in there, and these are the 2 placeholders that we need guidance on determining how to get to. There's about a $1.193 million in expense reductions to get us where we need to be, and $1.8 million in revenue increases. So it's about a $3 million swing that we're looking at that gets us to be balanced. So those are currently in the budget as placeholders that we need to make decisions on. So when we talk about that, so that's the $3 million, and then we have our annual landfill contributions. We'll talk about those a little later, that we typically contribute to these 2 reserve accounts. And those annually are typically $2 million. So in an ideal world, we'd be finding a way to come up with $5 million total. But for today's discussion, we're really focused on this $3 million number to kind of get us to be, so we're not structurally. Okay. So we'll go ahead and move on, and I'll go over what our services are. So we are the Solid Waste Authority for the county.
Maybe we could stop and pause that. I'm not sure what's going on.
I think it's my delay.
It was doing that earlier.
Okay, let's talk through it. Okay.
It stopped before.
Okay. There we go.
Okay, gotcha. Thank you. So we serve as a solid waste authority for Lane County. We'll talk about what that means in a little while. And we are an enterprise fund, right? So we're solely funded through user fees. We don't have any other revenue stream. And so everything that we charge at our transfer stations and landfill is what funds our division. So we, on the next slide, we run Short Mountain Landfill. And so I think everybody knows that. We operate that landfill. And we have some big capital projects that happen at the landfill. And so this is where we talk about constructing new landfill cells. And so those cost typically between $18 and $20 million to construct a new landfill cell that'll last somewhere in the 12 to 15 year range. And so when we talk later about those reserve funds, you'll see why we put that money aside annually when we can. On the right, you'll see our latest closure. So that's a landfill cell that we permanently closed. And so we also do those closure events. So we'd obviously rather close those cells as quick as we can so they're no longer creating leachate and things like that and kind of be permanently closed. We have the most transfer stations in Oregon. It's quite a robust network of transfer stations. Most of those were old landfills before there were regulations that then when regulations came through, we took them over and converted them to be transfer stations where you temporarily bring materials and then we bring them to their final resting place. So this is a map that shows you all of those transfer stations in the county. And most importantly, I think with our fee structure is the system benefit fee. So it's relatively unique in the way that we collect the monies for the system benefit fee. So these are paying for all of the services that basically don't run the landfill. So we charge that portion of the fee whenever you pay at a transfer station or when a hauler pays at the landfill. They're paying the system benefit fee, which is about 48% of the total fee that they pay. And so it's hard to compare us apples to apples with other landfills because they don't charge that extra fee. Those fees are typically charged in another way. So to compare us to Dry Creek, for example, that might say it's $90 a ton for us to bring waste there. That's $90 just to run their landfill. It costs us somewhere in the $52 a ton if you were to compare apples to apples. So we're actually a very efficiently run landfill if you're just speaking about the landfill services. When you add on all these other services provided to our community, that is where we talk about the system benefit fee. And we'll get into that next where we talk about what that pays for. So some of the things that pays for household hazardous waste program, so that facility at the Glenwood transfer station where people can bring their poisons and paints and other toxic materials and batteries and things like that. That's paid for through the system benefit fee. Even the companies that use that pay a much smaller fee to dispose of those materials because it's subsidized through the system benefit fee. We also take that show on the road and go to Florence a couple times a year. We just went to Oak Ridge, and we'll bring a mobile collection event to the communities so they don't have to come all the way into the Glenwood transfer station to do that. It also pays for our education and outreach that we do in our recycling programs. It helps to subsidize some of the recycling costs, so we know that recycling costs as well. And so all of our school programs, education programs that we do, and also help us, we are that waste authority, so we work with cities to be in compliance with the DEQ mandates around their recycling and including the Recycling Modernization Act, and we spearhead efforts to get funds out to cities as part of the Recycling Modernization Act, help with grants and such. So that was a real quick overview of what we do, and now we'll talk a bit about our shortfall. So earlier we mentioned it's a $3 million deficit that we need to overcome. That's what we're looking for guidance on. And then we have these annual landfill contributions. So we typically put about $1.5 million into our cell development fund. Again, that's how we get to that $18 million after 15, 18 years. We save every year typically so that we have that in there. The other remainder, about $500,000, we put in that closure and post-closure. We're lucky in that right now it looks like our closure and post-closure is about where it needs to be. That's and we're mandated to have that where it needs to be. And so basically that means that if we were to close Short Mountain Landfill tomorrow, we would have enough funds to be able to close the remaining open parts of it and monitor that closed landfill for 30 years.
May I ask a question? We are required. Are private landfills also required?
Yeah, everyone's required to have closure and post-closure money, yes, to run the landfill. And we were, that's part of when we, in 2014, looked at our fee structure, realized we were short in that area and we needed to make sure that we had enough money. And it's a little different for government, than it is for others, but yes, everyone's required.
Jeff, who monitors and enforces that? Is that a DEQ function?
Yeah.
Thank you. For private and public?
Yeah. Okay. So here's what our reserve accounts look like right now. So in terms of closure, we have $8.7 million that would go towards closing the entire landfill if we needed to. And then we have $3.5 million in that post-closure. And what we do is we measure out the 70+ years of landfill life. We come to what we would estimate today to be that number if we had the complete landfill, and then we work every year to get towards that. It does go up and down, so our closure, for example, was much higher a year and a half ago because we just closed a whole cell of the landfill. And then our cell development's currently at 0, and so that's an alarming number. We need to start construction on the next landfill cell in 2 years. And so that's a big aha moment where we'll be coming very quickly up against how to fund the next landfill cell. And then we have, and this has been talked about widely, we have a waste exportation issue. So about a $5 million revenue, is $5 million worth of revenue being taken out of the county at the current landfill rate. And just remembering that 48% of that $5 million is money that doesn't go to the landfill. That's monies that helps to do the hazardous waste facility and all those other things. So we've continued to provide service levels of the service levels before waste exportation for the last couple of years. And that's a big reason why we're in the situation we're in, is we've continued to have all those transfer stations operate the way they will. We'll show how those run at a deficit. And we've continued to offer all these programs to the community while not receiving that 48% of the fee that pays for those things. And so the main contributor has been, Waste Connections on Sanapac, and then they've been using their facility next to us, the EcoSort facility, to bring that waste in and then transport it down to Dry Creek, a landfill that they purchased. And then on the next slide, it just shows, this was also shared, I think, in March, kind of shows where else Waste Connections is. I think kind of demonstrates their method of vertical integration, if you will, kind of trying to own all the elements of the waste system so that, you're collecting, you're transporting, you're disposing, you're collecting recyclables, you're bringing those to a facility to take care of the recyclables that you own. And so it just shows you that they're a pretty big company outside of Oregon and in Oregon. We did a proposal to Waste Connections, asking for, if we were to reduce our rate to $100 per ton, to pretty much match what they have publicly stated their rate would be next year. Would they, go ahead and bring that waste back? Everybody's paying the same. The rates go down for folks currently using the landfill, and looking at doing a 5-year agreement with them. Similar to kind of what those waste haulers do with their franchise agreements, right? They'll do 5-10-year agreements with cities to lock in the service that they provide. And so kind of looking at a similar thing. So trying to work with that company to bring that in. I think it's important to note that today what we're trying to do is really find a way to meet that $3 million structural deficit. This option would then return waste, and we'll talk about what those numbers would look like, that I think would help us towards those reserve funds for the landfill and some of those other services that we provide. And so this is not a one-size-fits-all solution, even if it was to happen. And then we have Clean Lane. We have to note that there's a $35 million bond that has not been accessed or pulled yet, but it is in the budget. There's about, I think, $15 million of that is in the budget to be spent next fiscal year as part of construction of Clean Lane. It's a 2-year construction cycle, so it goes over 2 fiscal years. But that's why you'll see this $35 million number, so we need to make sure to note that. And again, that has not been accessed, that's not been realized yet, because that would be something that would be pulled when and if that project was greenlit to begin construction. And then folks know, we have the land use denied for the Goshen site, and right now we're negotiating with a company about moving that to Short Mountain. And so those are negotiations that are happening this month. So Potential solutions. We kind of have been looking at this as a menu of solutions because there's not one thing, as I mentioned, that we can do to solve this. It is going to require a few different actions in order to solve this issue. And so we'll start with tipping fee reductions. And so, one would be to lower that, right? And so that is a tonnage-based, landfill-based solution that we talked about, incentivizing those haulers to come back to Short Mountain, use Short Mountain by lowering that fee and doing that 5-year agreement. So we estimate that with all the waste that's being exported, that if all of that came back, the net gain would be somewhere around $3.2 million. And the reason why the $5 million going out doesn't equal $5 million coming back is A, the rate's lower, so it's about a 10% reduction in the rate, and we also would lose the current revenue from all the haulers currently using Short Mountain. They would also see that reduction. So there's a net loss with the current waste coming in, right? So that's why it's not a one-to-one. So just wanted to make sure we knew that. But that would be somewhere a little north of $3 million, we estimate, would return back to the other things we could do is service reductions and fee increases. And I know it sounds a little odd to talk about a fee decrease and then an increase. These increases would not be on ton-based fees, right? So these would not be an across-the-board increase. And so we would need to reduce transfer station costs, and that's something that we would probably need to go to the board with a work session to determine, get some guidance on. That would be things, hours reductions, maybe days open reductions, maybe transfer station closures are the largest ways you can find to kind of reduce those costs at transfer stations. And then we could look at adjusting the fees at the transfer stations. And so we'll talk in a minute about what that could look like. There's a couple options we could do in terms of the fees at transfer stations. And then finally, towards the end of the presentation, we'll talk about removing our contribution to the climate funding and discontinuing the recycling rebate. And we would look at what those would do as we get towards the end. So we're now going to go through the transfer stations. I want to be clear because there's been some, when we look at the transfer stations, we look at those net losses, we're really only talking about the people that work at those transfer stations and the cost to move those materials out of it. We're not, we haven't drilled down into, what the utilities are at those sites. And, vandalism. A lot of our sites, Oak Ridge is a good example. We have 2 fences. One has been destroyed for about a year. The other one was just recently. So we're fixing a fence, and then we're fixing tears in fences every day, and people are coming and vandalizing. They're stealing things. So it does happen quite often. So we don't have things like that. General upkeep and the maintenance isn't necessarily included in there. But this is so these are pretty solid in terms of they would be realized. Also wanted to note that a net loss doesn't mean that, if we closed a transfer station that would be the amount saved, right? Because that's the loss with the tons coming into that transfer station and all the operations, it's a loss. And if you closed it, those tons would go somewhere else. And so you'd have all that revenue coming in without all those expenses. So it'd be larger. This would really reflect what would happen if you raised the rates to make them break even. Right, so at London, that would be, you'd raise the rates to make another $14,000 to have it break even if you were to keep that site open. So we'll go through, often what you'll see is that, sites that are farther away are going to lose more money because it costs a lot more for us to haul the waste from those sites. So Florence is going to be, one of the most expensive because you're going all the way from Florence. Over here. I do want to note on Glenwood that because of the way that we did this, it only shows your transfer station operations. So this looks like there is an almost $700,000 revenue there, but it's not taking into account the HHW, the household hazardous waste facility that operates there, the mechanic shop that we have there, the fueling island, the Vactor facility where vehicles come in to get rid of the Vactor materials and managing that. We have a truck wash rack that commercial haulers can use. And we do. We have our leachate discharge there. All these things that cost us money aren't included in there. Just we were working to say the revenue it takes in at those fee booths versus the cost for those folks to be in those fee booths and our recyclers equals here. So it's an apples to apples kind of comparison. And so it shows you a net loss of almost $1 million across the system to operate our transfer station, paid for by the system benefit fee. Our minimum fee is currently $15. This is showing our comparator counties and some other landfills what their minimums are. So of those comparators, not only the cheapest, but by quite a bit. Again, system benefit fee helps to support that, to ensure that it's kind of equitable across the transfer station system. So some of the ideas, just as we look at, is you could raise that minimum fee, and so a $5 increase is just south of $1 million that it would take in just by increasing the minimum fee and no other fees by $5. And obviously, if you raise it by $10, that would be double that. So yeah, at the very end, we're going to see this range, and that's because we have different options. And then if we went with the non-hauler fee increases, so we gave 3 potential increases here, the CPI and above. It shows you revenues you bring in from non-haulers. So by not doing anything at the landfill, not raising the landfill rate, but raising rates on landfill fees kind of across the board at those 3 levels. And again, independent of that minimum. So this is why the menu's there. If you did a 2.5 and a $5 minimum, that'd be 1.27 million, because they would be in conjunction. So the recycle rebate we looked at, originally created as a way to incentivize recycling. The thought was that people would recycle if they had a reason to, that was $1, and not feeling so much like that's a huge motivator for folks anymore. It cheapens their waste load, right, by doing that. And so that would be $174,000 if we discontinued that. One option would be to add on. So we have a senior rebate as well. That's $1, and maybe we thought about adding like a SNAP recipient and a vet discount onto that one. So if you're any of those 3, you get the $1 off, but not an additional $1 for recycling. And so right now people can come in and kind of get $2. They can bank those 2. And then we contribute about $232,000 a year to the climate program in the policy department. And so if we were to not contribute to that those combined would be about $400,000. And then this shows you the total kind of budget impact. So trying to put those different pieces in categories. So showing that a minimum fee increase, it's not an either or. You can do $6 or $7, but it shows you the range from almost $1 million to $2 million. Those transfer station adjustments, what we've said is we would commit to trying to find a way to adjust transfer station costs down by $400,000. And that's something that we need to work with the board on how we would get to that $400,000. It's so complex that we haven't, there's a lot of ways you could get there. And then you have the recycle rebate climate funding and those CPI increase ranges. That gets us between, if you want the low end on everything, 2 million. If you want the high end on everything, 3.8. Our goal is 3. So we're somewhere in the middle there is really what we're looking to do. So that's the overview that I have in terms of the services we provide and some of the ways that we were looking at to try to get towards that $3 million number. If there's any questions or...
The numbers that we're seeing right here, does that take into account the reduced fees that are being offered to Sanitag and others?
No. So the reason why we wanted a guarantee with them was so that we would know the tons that were coming back to offset the decreases, right? So we would only do that if they agreed to bring it back.
And that was kind of a loaded question. So
yeah.
if Springfield's waste suddenly starts not driving past Short Mountain, then this is not necessary, or potentially less necessary.
I think that would be a decision for the budget committee, right? Because if that brought us $3.2 million, yes, that would get us structurally balanced. It would not get us where we need to be with the Short Mountain Reserve so we could build the next landfill cell. So our idea is that certainly maybe, there could be this menu of if that happened and there's another 3 million, maybe the committee chooses to go with $2 million in adjustments instead of 3 here, but we would still recommend some sort of service changes that are up here in order to kind of make us whole again and get us on that right track to have those reserves.
So we couldn't just say, hey, y'all in Springfield, y'all in Junction City, quit making garbage. Couldn't do that, could we?
That's hard. Yeah, we've not found that to be successful yet.
Anybody else?
It seems to me, Jeff, that you're gonna have to do a combination of both of these, probably at the higher end, because in 2 years, I don't see where you're gonna get $18 million to open up a new cell,
Right.
right? I mean, so you're still gonna be short, even if you did both, you're still gonna be short $12 million, or give or take.
Yeah, and we will, the last landfill cell that we built, we did in 2 phases. We could do that again. We'll know more what's the waste outlook look like. Kind of what's happened to us is we've had this waste exportation happen towards the back end of the current landfill cell. So the reduction in waste hasn't really elongated the life of that cell because it was towards the end. So maybe we could build the first half of it and maybe that gets us longer, so it goes from 18 million to 9 million to get half the cell built, and we buy some time. But you're right, we definitely, that's why I think we're looking at, we have to do this and we have to address this waste exportation.
How long does it take to build a cell?
We built half the cell about 1 construction season. Yeah, almost a year. Yeah, I think we usually start as early as we can in the calendar year, and then we have it buttoned up by usually October before the rainy season.
Does anybody else have something? One other, you talked about reducing fees, which if you did it for Santa Pac and Cottage Grove garbage, then you have to do it for the others,
Right.
Which I understand that. And maybe I'm wrong, but at some point in the past, as I recall, that reducing the fees to get more garbage to come into Short Mountain, what does that do to the longevity of Short Mountain?
Mm-hmm. Right. So to get back to where we were, it would keep us on the trajectory we were on in terms of the 70+ years of life, if we were to bring all of that back.
Okay.
If we said now we want to open it up and take waste from everywhere else, that would shorten it. The examples like Coffin Butte, they have about the same waste stream that we do from their community, about 300,000 tons, and they bring 1 million tons in a year because they're bringing it in, from others. So, yes, that would return us to levels we were at, and not shorten the lifespan of the landfill.
Yeah, it's not catastrophic by doing that. That was my
Right, right, yeah,
If all of a sudden that would cut it in half or something. Okay, no, that was my question. Thank you.
Mm-hmm.
Commissioner.
The impact of the closure of other landfills subsequent to today. We're talking about ours being 70 to 80 years as we continue adding new cells. That's the total capacity as we put $18 million per new cell in. If we stop doing new cells, we don't have 70 to 80 years. We have, look at your watch, not your calendar on it.
Right. Yeah.
Okay.
Yeah, I would say one key difference is because we own the entire parcel, we've had a development plan for years. We have all those cells developed out there, and so the approval process looks a little different sometimes for us than others. But yeah, we're really lucky the lifespan we have.
Then, so currently, Coffin Butte and others are taking extraterritorial garbage. Coffin Butte is getting garbage from Lane County, for instance. Okay, all right, that's all. Thanks.
They're getting mostly from out of their own.
Can I get you to expand a little bit on, you said Lane County has the most amount of transfer stations in the state of 15, and then I just quickly looked at the map, some of those like London, Cottage Grove are 15 miles apart, right? You're not gonna not take your garbage somewhere for 15 miles. I know that we want to serve all the communities, Veneta and Walton are, 16 miles. You obviously lose some of those losses, but you still gain the revenue. Can you give a little bit more color around that?
Yeah, each one, transfer station would be different in terms of what it would look like. But yes, no, I think what you're getting at, if I'm hearing you correctly, is yes, they're pretty close together. This is a system that we inherited when haulers weren't servicing a lot of these rural communities, and that's simply not the case anymore. There's a hauler that goes down to Triangle Lake and can pick it up. So, that's a key. But you're right, if you close a transfer station, a Walton, for example, that waste, you're right, it's close enough to Veneta that it's gonna go to Veneta, so that's gonna be extra tons in Veneta, a little bit extra on operations, but really it's not significantly gonna impact the Veneta transfer station to take in the waste from Walton. And I think one of the key things we look at, you named a couple that we've named too before in terms of looking at customer counts.
Yeah.
You have a dozen customers, Veneta's not even gonna realize that, it's not gonna impact them to have a dozen more.
You're not going to have to change your hours of operation or FTE or anything in that facility.
You wouldn't depending on the transfer station where you're at, the ones that you're describing that are near Cottage Grove or Veneta, correct, they would absorb it.
Can you go to the number of customers, Angela? Okay.
Oh, excuse me, Commissioner Buck.
I would just add that my concern is that we're assuming if one closes, that people will bring it to a different transfer station. And I'm not sure that we're going to get 100% movement to another transfer station. And then that begs the question, like, where does all that garbage go? And the big concern for me is that it's just dumped somewhere, wherever in the county. And then we get notified, somebody complains of dumping. We have to go then clean it up, which costs exponentially more than if we had just allowed them to come to the transfer station in the first place. So there's other costs, like, I don't think it's simply a combination of two.
I'm not gonna just say that.
And combine, there's gonna be other peripheral costs to closing any of these stations.
Right. And I think that's a great point, and why I think it's important that we have that discussion and really look at those, because I do, I think that some transfer stations you're at much higher risk of that than potentially other ones, depending on where they're at and the customer counts. And anecdotally, what we have seen in terms of activity at those transfer stations when we're not open. Most of those you're mentioning are open 1 day a week, and we typically find a lot of things at the gate. So illegal dumping, but going to the place that they know it's supposed to go to, just maybe not wanting to pay, which I don't know if you close it, does that show up at that gate anymore? Does it, so we have a lot of activity that occurs. We did close Mapleton some years ago and didn't notice a lot of increased dumping in that area. However, it also was near enough Florence and Swiss Home. It was kind of strategically located, and that to your point, it wasn't too much of a burden to go somewhere else. They weren't going from there to Veneta.
So we looked at this back in 2014-ish to close several transfer stations. People love their transfer stations. We had community meetings out there. A lot of people showed up in Walton very upset that we were looking at closing the transfer station. Same thing in Cresswell and in other communities. So it will be a challenging decision if that's the route we need to go.
I may have missed this in the presentation. When do we expect to hear from Sanapac?
We did receive an email. We've asked them, I think it's been 3 different times over the course of the past 2 months, we've made our proposal to them and requested again and again for them to respond. We did receive a communication from them either on Friday or yesterday. They essentially are saying, I mean, I read it as a rejection of the proposal. They're saying that they find it difficult to accept the reasons. They find our proposal difficult to accept for the reasons set forth below. They talk about a bunch of information that they say they need about what the county's current costs, expenses, profit and loss associated with operating each individual transfer station. Do the transfer stations rely solely? They want to know sort of the business model around everything, which frankly, it's not, that information is not at all relevant to a decision, right? What we're trying to do is make a proposal that is market-based, to say, hey, we're gonna set our rate comparable to the rate that you're paying at Rye Creek. And we think it's a win-win. You don't have to truck all that waste. It'll actually result in the lowering of fees, we believe, for customers in Eugene and other parts of the county where they're not exporting waste, and it should result in the stabilization of rates in Springfield and other places. So it's sort of a non-response with a rejection in saying they want more information. But then they down later in the email, they also say they need more information to make a decision, but then they also say, we can't do that, we can't agree to it because the cities haven't agreed to it, and the cities don't want to do intergovernmental agreements and determine where the waste goes. So it's I mean, frankly, it appears to be sort of a delay tactic, and it's really unfortunate because of the impacts that you see here in terms of reduction in service and increase in fees to our residents.
Thank you. That's helpful. Not helpful, but helpful.
Yeah. If you know anyone at
Right.
Sanapac, please, reach out.
And you put up the vertical integration slide.
Yeah.
No. I just want to have that on the board.
So the 232K for climate work, is there any FTE involved in that, or is that just funding to the?
It's one FTE.
At the policy side.
Yes, correct.
Anyone else? Anything else, Dan? Joe? Oh, I'm sorry, Jerry. Too close.
So the increasing the tip fee, if you did that, can you do that specific to transfer station, or is it universal across all transfer stations? Because at some transfer stations, you're losing $40 every time a customer shows up. I mean, versus some of you might only lose $20 every time a customer shows up.
You can do either. Our structure, since I've been here, and I'm sure before, has been that the rate was the same. You go here, you go there, it's the same. But that is a model that other jurisdictions use, and they typically do it based on the haul.
Okay.
If you're farther away, so you could change the minimum fee to be different per site, or even it'd be harder for us to change like the other ones. But yes.
Yeah.
Yep.
Just to add on to that, we've just looked at it as a system in the past and tried to have a uniform system and not penalize people, based on where they live in rural areas and keeping steady fees across the system.
One more question. If you said Lane County has most of these transfer stations at 15, obviously we're a much larger geographic county than others, but what is other counties in comparison?
I would say Douglas County is the most similar. I think they have maybe 9, but for most of the other counties, just maybe 2 or 3. So we're very unique in having the density of transfer stations that we do to provide the service we do to residents.
In particular, honestly, I think it's also in the urban area. I mean, Cottage Grove, Crestwell, the landfill, Glenwood. You typically will find, in population centers, you're gonna go 20, 25 miles if you go. Yeah.
Thank you.
We're also used to the system. The community's been used to the system for generations. So, to your point, it is difficult to think about major changes and what people are kind of used to and service level-wise.
Yeah, but I mean, to your point, if you're open one day a week and everyone drops it off when you're not open, you're not making any fees anyways.
Right. Yeah, and the hard part is if you have it there, even if it was, we've debated that, well, maybe you just don't staff it and you show up once a week and you just move the boxes. It doesn't really save us a lot of money because we're still servicing it, right? And so, but yes, depending on the site, it depends on where you're at, more people using it off hours.
Thank you for your time.
Thank you, Dan. Jeff?
We have difficult decisions ahead and appreciate your input and guidance.
Thank you.
Cool.
Thanks, Lynn.
It's been a fun day. Okay. Agenda is
700 people a year that go there. People a day that go there.
Okay, do we have any committee business?
Nothing from staff, I would look to the committee.
Oh, Holly?
I just had a question about the TLC funds, if now is an appropriate time.
Sure, talk about it, you mean, or discuss, or whatever?
Just
Yeah.
a question.
Oh, sure.
Super helpful to see this laid out in this way, Christine. And I just was looking at the 1% of the unallocated annual, and then the combined 4.8 for patrol, and the 1.7, and just trying to align that with kind of my understanding of it. And just had a question about the patrol, the funds for the patrol for fiscal year 27-28. And outside of this budget year, I was just curious how that works, if that's a decision we can make.
Well, yes, because the budget includes a transfer over to a patrol reserve is what the plan would be.
Perfect. I knew there was probably some mechanism, I just didn't quite understand.
So the transfer happens in this budget cycle to set it up to be spent in 2027.
Yes, yes.
So it is just this year, action this year.
Which is essentially what we did.
Right.
I think that was one of the questions maybe that Jared had. What we did back in 2021 and 2020, was it 2020? 21 and 22 is, it was SRS funding that we took that has funded that, those additional deputies to date, but we took that funding and we put it into a reserve account that the sheriff has then spent down to be able to fund that service over the past 5-6 years.
Perfect, thank you. And then my only other question was the 1% unallocated annual for the courthouse project. Is that a one-time expenditure because it's a capital expense, or is that moving forward?
No, I think,
The
you're looking up
or the,
above
sorry,
reserve,
the
right?
2.1.
Yeah, so that's just showing the amount for, the code designates tourism capital. It has some other things too. We gave you the code language for operating, or I think that's the category that it's called. So it's, does that help? So it's not referring to it could be ongoing. It would be ongoing.
The courthouse project for the 2.1?
That's the same thing, ongoing.
Okay.
Yeah, for a number of years, yet to be determined. Yeah.
Okay. Great, thank you, that's helpful.
Any other committee business? All right, well, I guess we'll be here tomorrow. Thank you, everyone.
You'll be 2 shy and 1 virtual.
Yeah, we had a